So, welcome everyone. Thanks for joining our webinar, Can Alzheimer's Be Reversed? My name is Julia Holden. I'm a board certified health and wellness coach. I'm also a personal trainer and a Recode 2.0 certified health coach. And we'll get into what Recode 2.0 means here in a little bit. So I help people implement healthy lifestyle changes, not only with Alzheimer's, but people with any health goal. These are things like implementing nutrition changes, movement, sleep health, stress management, hydration, all those kinds of things. And I'll introduce our speaker today, Dr. Richard Chen. Thanks for being here, Dr. Richard. Dr. Richard Chen is a functional medicine certified medical doctor who has helped reverse illness in many patients who have been sick for decades. He is the author of A New Way to Health, a book available on Amazon on how he reverses illness. He has been in practice for 33 years, half of that in functional and integrative medicine. He is certified in Recode 2.0, a protocol that's backed by research to reverse Alzheimer's using lifestyle and functional medicine. So thanks for being here, Dr. Richard.
No, I'm glad to be on this. Or it's always good to sort of give information out to people to let them know it's available out there. So
Yeah. And so before we get started, I wanted to share a little bit about my connection to Alzheimer's and, why it's so important to me. So both of my grandfathers suffered from Alzheimer's before they passed, and I saw directly how devastating it was, not only for them, but also for my grandmothers, my parents, my extended family, myself. And, it's really scary knowing that it runs in my family. So that's why I'm, happy to support people with the condition and, research and learning all about it the best way I can. Dr. Richard, would you like to share your connection?
the thing, can we just are we recording this too, by the way, too,
Yes,
or
it is recording. Yep.
yeah? Yeah, I unfortunately I've had a lot of Alzheimer's in my life. Both my grandparents, my grandfather and grandmother who raised me from childhood, had Alzheimer's. So they were both like in the assisted living and later in nursing home in the later years and stuff. My father, who's a physician, developed Alzheimer in the last couple of years, and it was very emotionally trying to see him as he sort of deteriorated and the stress that my mom went through as she tried to be the caregiver for him and didn't realize that she was getting stressed out. And so I tried to help him get better, but unfortunately it didn't work out. But hopefully I'm trying to get other people other than my father get better. And so
Thanks for sharing, Dr. Richard.
the
All
thing.
right, I'm going to just go over a couple of housekeeping notes before we get started. So feel free, I think everyone's on mute, so that's great. Please stay on mute until we open it up for questions. So we will do about a 30-minute presentation and then save some time at the end for any of your questions. Feel free to save your questions till the end and you can just come off mute and ask. Or if you want to enter them in the chat as you think of them throughout the presentation, that's fine. Feel free to enter them in the chat and I'll go over all of the questions that are in the chat at the end, and we'll ask them to Dr. Richard. And yeah, I think that's all the housekeeping notes that I had. So I'll go ahead. I'll take the slides down so we can kind of see our speaker nice and clear. And then as we go through the presentation, I might bring some more slides up for some visuals. All right. So Dr. Richard, first question for you. What is the most misunderstood thing about Alzheimer's disease?
Yeah, I would just say it's interesting. They did a survey in terms of like 64% of people as they get older, they're concerned about the about fear of Alzheimer's, and so that's a pretty big concern wise and stuff. I know it was a concern for me when I saw all my grandparents and father with Alzheimer's and stuff. But I would say the most understood thing is like we're looking for like a silver bullet. We're looking for like one thing that will sort of make a difference and stuff that they're. But unfortunately, that's not how human health is. I've been working with human health as in an integrative manner for the last 14, 15 years at this point there and stuff like that. And what I would sort of say is human health is not about one factor, it's multiple factors. There's two, three, four, five factors. And so what the Recode protocol, Recode standing for reversal of cognitive decline, is talking about is that there are multiple factors. The initial protocol would talk about 36 holes in the roof and then fixing those 36 holes. It's actually expanded since then and stuff like that. But the analogy is still pretty good. Is like, if you have 36 things going on in the roof thing, and you just try to fix one of them, that's not gonna make much difference. You still have a leaky roof. Whereas the more you take care of the whatever factors, 36 factors, whatever factors there is, the more factors you take, the better it will be, because this is about sort of like getting the brain working well. And if there's multiple factors, let's take care of the multiple factors there. So yeah.
Yeah, it's about addressing more than just one thing and addressing, multiple factors that might be playing a part in the disease. So, Dr. Richard, can Alzheimer's be reversed?
Yeah, it's in conventional medicine we say no. We talk about medications and sort of like it could be expensive medications and talking about how we sort of like just barely stop it from happening. But Dr. Bredesen was a neurologist at the UCLA, and he was in the division of Alzheimer's, and he started this protocol back in 2014. And so there was the first patient he dealt with, patient zero. I'll give you a little bit more about her story because it's kind of really revealing wise and stuff. So this is a lady who was like, she couldn't remember numbers. She forgot to pay bills. She forgot to name her pets. She forgot to name her grandchildren. She would have to like refresh her memory of what her grandkids' names are before they visit because she would call them by the wrong names. And so, like, this is somebody who was going a little bit down in terms of mental health wise and stuff like that. And I think I think the point for her when she realized that things were not going right is like she was on the East Coast. She was traveling to Dallas, and she flew to Dallas. And then when she got to Dallas, she was like, "Why am I here? Why am I in Dallas?" And she had no idea why she was in Dallas. So she flew back home because she didn't know why she was in Dallas. That's a pretty dramatic point if you forget like that you don't know why you were traveling to a certain city and stuff like that. But anyway, so her story was like, she started getting brain fog in her 40s. She got a doctorate. She was like an international consultant. She was like working 3 to 4 hours. She was sleeping 3 to 4 hours a night because she was working so hard. She was living in moldy buildings. She was traveling internationally, got a lot of infections, gut infection, parasite infections, and stuff like that. And she, relaxed by drinking alcohol. And so, when she got involved in the protocol, I mean, she actually reached out to Dr. Bredesen and found out about him as he was doing the research there. And, she started the protocol with the help of Dr. Bredesen and her doctor. She's improved her sleep to more than 3 to 4 hours because definitely you need sleep. She changed her eating habits to a better eating habit. Lowered her alcohol, increased it, improved exercise, and took care of all the mold stuff there. I mean, there's a whole different factors there. But I would say, she got well. She like, now like they wrote up her study, and like 8 years later, she's doing well. She's an advocate for brain health because I mean, if you get that kind of result, you're like, this works. I want other people to know about it. So I think she works with Dr. Bredesen in terms of like as a patient advocate there and brain health coach. So
Wow. So she was able to go back to like fully functioning, now has, works full time and has no, issues
yeah,
with memory.
yeah, it's pretty cool. I think
Yeah.
that's a admirable thing because again to be if you're she was pretty like she was very intellectual. She had a PhD and stuff there, and then sort of lose that and then regain it. I think definitely you want to sort of like you do what you want to do, right? And if she liked using her mind, she was able to use her mind again. So
Yeah, that's incredible. So Alzheimer's can be reversed. Can it be prevented?
yeah, and so what they found is like the the earlier you catch something, the better and stuff like that. Because I would say Alzheimer's is a disease in terms of like neuron connection versus not connection, and if you have there's not so many. If you catch it early, there's probably not so much neurons disconnected at that point there, so you can do more. And so in general, the earlier you catch something, you can do okay. But there's a test called Montreal cognitive assessment, which takes a look at how some people are thinking. And it's from 0 to 30. But they actually had people who were at Montreal score of 0, which is pretty bad. I mean, you can't like you don't know like where can't go through the numbers, you can't figure out shapes at all and stuff like that. And they were able to recover those people. And so, but I would say in general, you want to catch things earlier. But if you're a little bit later on, can pretty valuable, and it's not as more easier as it is when you catch it earlier. But you can still have possible good results there as well too and stuff. So
Wow. So for those of us where we have like Alzheimer's that runs in our family, there's things that we can be doing, to help prevent our decline later.
yes, yes, totally. Yeah, there is.
Wow.
Yes.
Okay. So can you tell us more about Dr. Bredesen's Recode 2.0 protocol, and why it works?
Yeah, so I think it's kind of cool. I mean, because it's more like of course it's a brain-centric protocol. I mean, I would sort of say, you know, he did research back in the early 2010s talking about the amyloid precursor protein, and the amyloid precursor protein is involved in terms of like you can either make more neuron connections or make less neuron connections. And so what he did with this is the Bredesen 7. If you start off at the top part, you have the nutrition, which is important. It's actually a ketogenic diet because a ketogenic diet gives you ketones, which is the preferred fuel for the brain. Exercise, which increases blood flow and is good for a lot of things going on there. Sleep is how your body, you sort of take out the garbage for the brain. You encode your memories. You need sleep. Stress is not good for anything, including the brain. So the lower like stress management is cool. Brain stimulation, and if you sort of learn a new thing, such as like a new language, new musical instrument, whatever, that's going to be helpful for you. And unfortunately, a lot of stuff we have a lot of environmental issues going on there or chemical issues going on there, and we take that out of our system. That's better. And supplements definitely can do a lot. They're in terms of them, they're usually more natural, and they can sort of help more in terms of modulate our system and sort of help them along, either give it nutrition, give it vitamins, and also sort of work with our body in a more gentler way than medications and stuff like that. And so that's why it works, because this is a protocol just based on the brain, and it gives it the fuel and takes away the stuff that doesn't work for the brain, and giving the right things as sleep, stress management, and so it works, and it can work from a couple of weeks to, but usually it takes several months or so for it to work and stuff like that.
So it takes time. You're not going to see improvement like right away, but things take time. It might take even a few months before you start to see some improvements.
You can, but I think the diet thing in terms of the ketogenic diet is pretty interesting, because as over time as we get older, normally we feed our brain with sugar, glucose, but as we get older, our ability for our brain to utilize sugar as a fuel decreases. And so like if you're giving the proper fuel of ketones versus sugar, you're feeding the brain better. And so that's why some people can get better within weeks or so, because if you're fueling the brain, which it wasn't fueled before, then that's pretty major and stuff. So
Yeah. And so tell us, this is personalized too. Like when you go through the Recode protocol, isn't it true that you do a slew of like lab testing so that they can figure out, or your doctor or practitioner can figure out what's going on in your body before they recommend supplements or certain detox protocols?
yeah, this is totally personalized. I mean, so it's not like a one size fits all protocol. I mean, the foundation may be a little bit. I mean, it's the same foundation wise, but everybody's different. I mean, even if you're twins, you're going to live in different environments. Have different emotional issues going on there and stuff there. So it's all personalized based on what a person's gone through their life, what they've been exposed to, how their genetics are and stuff like that. So it's really it's I mean, that's what the functional medicine, which is this is basically functional medicine for the brain, is like, everything is personalized for the individual person. So that's how it works so well.
Yeah. And so how does this Recode 2.0 protocol differ from, your typical standard of care?
But let's look at the next slide, and I'll talk to you about that and stuff. So this is a protocol I'll talk about. This is like a study I'll talk about later and stuff like that. But this came out, I believe, in December of 2025. It's called Avanthia, which is the Precision Medicine Protocol, which is basically the Recode protocol. And if you look at this, it's basically talking about this is how much better it is compared to other things. And so if you compare, like, Avanthia is like, 1.11, so that's pretty good in terms of like here's these are our standard. These are the standard things that can be treated otherwise. Ornish lifestyle thing was more about using a vegetarian diet, using supplements as turmeric and stuff. But it wasn't really personalized. It's more like this is like a great lifestyle, and you should all do this there and stuff like that. If you look at the next things that like donanemab and lecanemab, those are monoclonal antibodies which work against amyloid. Remember, I was trying to find, that convention that we try to use more silver bullet. Well, those are the silver bullets we're talking about. You're try to deal with the amyloid, but you don't have much results. I mean, here's like, you have like a 0.16 result, or you have a 0.29 result. I mean, if you use the Avanthia, which is the Recode protocol, 1.11 versus 0.16, it's like 6.5 times better than a $26,000 drug per year. So there's a lot of difference in terms of, like, in terms of the results. The results say that the Avanthia is doing really, really well. It's better 6.5 times better than a $26,000 drug. And it's in terms of there's another lifestyle thing called Pointer, which is using like a Mediterranean diet, in a hypertension diet wise and stuff. But those are more like lifestyle things, but they're not really personalized. Whereas the Avanthia thing, the precision medicine, the Recode thing, is personalized lifestyle thing. So it's lifestyle and sort of medicine approach to sort of getting things better for the individual. So
Wow. Can you tell us more about the Avanthia study, and what else that it showed that backs, that this protocol works?
yeah, yeah. So they had 73 people on there. 50 people were in on the study, and then 50 people were into the precision medicine stuff thing, the Recode thing. I'll just say Recode; it's a lot easier to say. So 50 people were on the Recode part, and then 23 were on the just on the we call it the control thing, where they just got standard of care and stuff. And so they treated them for over 9 months. They did MRIs before and afterwards. They did all this testing and stuff like that. And if you go to the next slide, I think let's see what's going on there. So if you look at the cognitive system, so the dotted line is the Recode protocol and stuff, and you could sort of see how the symptoms in terms of brain dysfunction improved over time. Whereas the standard care, maybe it helped a little bit, but not that much. Whereas the dotted line goes down quite a bit over 9 months. So it was definitely from a score of 50 down to a score of to like a little bit less than 20. So that's pretty good. Yeah. Let's go to the next slide. So this is like a assessment that you do quite a lot. This is a Montreal cognitive assessment is the one we hear a lot more about. It's like they use you count back from 100. You look at different shapes. You go through a maze thing and stuff there. But you sort of see again that in the Recode protocol, the score of 24, it goes up to 30. The higher the score, the better it is and stuff like that. And so it went from 24 to 27. So that's pretty good. So I mean, over 9 months. So definitely there was an improvement there and stuff. So and then I think there's one more slide after that there and stuff. And basically, I mean, basically, it's like they're showing is like the thing that you could care about is like what's the memory? What happens to the memory? And if you see this, over time, the memory scores improved. From memory score of of less than 90 to over 100 there and stuff like that. And whereas the regular protocol went from maybe 92 down to like a little bit above 85 and stuff like that. So there's one study, the one that had the Recode protocol was going higher and higher in terms of increasing memory, whereas the standard protocol you still have you have less memory over time. So
That is really fascinating to see because you know, when you know someone with Alzheimer's or you hear about it, you normally, witness them just, their memory deteriorating over time. But here with these people who were in this study who did the Recode protocol, their memory improved over 9 months. That's
yeah,
fascinating.
no, that's great. Yeah, that's great.
So, Dr. Richard, can you tell us who would qualify to participate in the Recode 2.0 protocol? What type
I
of, yeah.
I would sort of say, some people who are motivated to make changes. I mean, it's not the same thing as just taking a medication because there has to be more involvement than that. So, may have to you may have to change your life. You may have to change your diet. You may have to take supplements. You may have to sort of exercising more. You may have to do some brain exercises. But I think like, people who are motivated are good. People who may have family history of dementia, that would be a thing to think about there. People were noticing that they have issues in terms like, my memory is not as good as it should be. Or like, I feel like I'm sort of forgetting things a lot more and stuff like that. So, I mean, I think those are the main issues. Or, I mean, if you have diagnosis of like, minimal cognitive impairment or early dementia, those are all people that could do and stuff like that. So, yes.
And what would it be like for someone to, if they want to do the Recode 2.0 protocol, what would it look like for them to work with a Recode certified physician like yourself?
Yeah, so I would sort of say, the recode, what happens is like, when somebody sees me, first they do is they fill out a questionnaire. They sort of give me their life story there. I see them, I get the life story wise. I do a cognitive assessment. Maybe it's a module cognitive assessment, so we get a baseline of what's going on there. I examine them and figure out what's going on there. Sometimes I can do it with something called neural therapy, which is a German treatment for nervous system, and that's I did that on my father. He had some life-threatening injury on his head at one point, but then it recovered, but it caused a scar for the rest of his life. And when I treated that with the neurotherapy, he actually improved talking the next day afterwards, which was really, he's a very quiet guy, but he was able to sort of speak up a storm the next day, and it was quite impressive anyway. But anyway, but then I would just say, you do that there. And then I think working with Recode coaches like yourself is quite helpful too, because it's like it's evolving a lot of changes. Either your diet, your exercise, and so usually I would sort of say in general it may involve a coach just because it's a lot of changes and it's better to be sort of be able to walk through those changes and stuff. And then you sort of when you do testing, there's like there's lab testing you could do to sort of figure out what's going on there. And there's probably more specialized testing you have to do, like depending on there's mold issues, Lyme issues, infection issues, different issues going on there. And then you start the protocol, and then usually I would say for myself, I would say follow up on a monthly basis to see how things go with that. And that's how I would sort of say we're working. Yeah.
Yeah. Yeah. Thanks for sharing that. And yeah, you mentioned, working with, I'm a Recode 2.0 health coach. So, if you were working with a practitioner, to do all of the diagnosis, the lab testing, the protocol, the follow-ups, working with a health coach in between those practitioner or, physician appointments is helpful to, really stay on track with that Bredesen 7, that Dr. Richard mentioned, with the ketogenic diet, exercise, having an accountability partner, guidance on, different strategies to improve your sleep, helping you through a detox, all of those types of things. Well, Dr. Richard, is there anything else, that I haven't asked you yet that you would like to share?
I think what I say is like, this protocol has been around for a while, but I think it's still not well known. And I would sort of say the studies are there, and I would say, this protocol works. There's been books written by Dr. Bredesen about all the patients that have been helped at this point. I think there's a couple of thousand patients have gone through this protocol. And I would just sort of say, sometimes people sort of say, well, how come my doctor doesn't know about this? They're like, well, unfortunately, sometimes what we learn in medicine, takes up to 10 years to get to other medicine there. So it's not really about like, does my doctor know about it? It's more about, does it work? Would this help me there? Because I think I, I just think in terms of the just seeing how my dad went down and how my mom got affected by sort of trying to take care of him when she was stressed out and didn't realize it, it's not it affects your quality of life. And I think it's like, for myself, when I growing up, I said I don't want to have Alzheimer's, and I think I didn't have the tools to sort of prevent myself from having Alzheimer's. I think it's like, it's for those people who would say, I don't want to have Alzheimer's. I was like, there is something you can do about it. You don't have to sort of like let fate decide. You can do something about it. So yeah.
Oh, yeah. And you bring up a good point about, maybe you bring this up to your, primary care physician or, your other doctor that you see, and they may not have heard about it or they may not be up to speed. So it's helpful to work with a Recode certified physician. And there's, we have Dr. Richard here. There's a lot of other physicians out there who are, certified in this protocol. But you can work with your primary care physician too, if needed. Is that right?
Yeah, I would sort of say, in terms of what I would say is it's probably working with a Recode physician, and also preferably one that's also functional medicine certified,
Yeah.
because it's a different way of thinking. It's trying to do with multiple things at one time, and so a functional medicine person who's got Recode training will be a lot better qualified to handle that than just somebody who just that's what I would say. Yeah.
Okay. So yeah, so you want to look for a functional medicine physician if possible, a Recode 2.0 certified physician,
Yes.
if you're looking to partake in this protocol. Anything else, Dr. Richard, before we move on?
No, 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 that's what I have to say.
Okay, great. Well, thank you so much. I do have one thing I want to share before we dive into any questions from the audience today. So if this message, if you receive this message and you yourself or someone who might benefit from having a conversation, getting some more information from Dr. Richard and myself, I'll be sending out a link after the call so that you can schedule a free 20-minute conversation with Dr. Richard and I. Again, this is just a free call that you can have 20 minutes if you want to ask any further questions or get any more information from Dr. Richard and myself on this protocol and if it might be right for you or someone that you know. So again, that link will be coming out in an email to all of you after the call today. All right, so I'll go ahead and open the floor. If anyone has any questions that they would like to ask Dr. Richard, feel free to just, come off mute and ask away. Or you can put them in the chat too if that's easier for you.
I'm not sure the chat is working.
Oh, okay. Sorry about that. Do you have a
Okay,
question,
now I
Tracy?
see one. Okay. Okay, great. And now it seems to be working.
Okay. I guess to answer Caitlin's question, yes, I will send you the recording afterwards so you can have the full conversation. Tracy, did you have a question you wanted to ask?
Actually, I do. So
Okay.
what is the difference? So my dad was diagnosed with dementia at age 65, and he's now 82, and it's been a very slow decline. What is the difference between dementia and Alzheimer's? I'm not quite sure I understand.
Yeah, I would sort of say, in terms of there's different types of dementia, but I would say the predominant type that's around these days is Alzheimer's. I believe it was named after like a Pacific neurologist, Lois Alzheimer or something like that. But I would sort of say you can make a decision of you can make a diagnosis of Alzheimer's based on there's certain blood biomarkers you can see which you can take a look for the different ratios of amyloid and that kind of stuff there. The other things that there's other types of dementia like Lewy body, frontal temporal. They're a little bit different, and so they may have more different kind of features in terms of your movement issues, or maybe have more hallucinations or more aggressiveness. But I would say in general, if he's gone down over time, most likely he has Alzheimer's, probably, I would think so.
We have a question from Joy. She says, do you recommend the p-tau 217 test, GFMP, NFL, etc.?
You can. It depends. I mean, I look at those testing wise. I mean, the testing can get it's more. I think it's more about it gives you a test to follow. And so I think they can be the cost can be on a higher side. You can definitely do that, but I think it's more if you use that, you can use that. But I would say you should also treat the Alzheimer's and then see how things go with that. Because I think if you that's more of I would say it's more of a diagnostic tool, and if you put more money to testing, then that may affect how much money you can put into treatment wise. But I think it's a good test. I mean, I think there's a lot of been work done with the biomarkers over the last year or so, and there's definitely a lot of tests you can do and stuff. So yes.
Any other questions?
I did have one thing I forgot to mention there. So there's different subtypes of Alzheimer's. And so everybody's different and everybody has multiple types of usually if somebody has Alzheimer's, they have multiple types. So I would say, type 1 is inflammatory. So that's usually more like an inflammation. We talk about inflammation is no good. So type 1 is inflammatory. Type 2 is atrophic, meaning that, as you get older, we lose our vitamins, we lose our hormones. And so that may be an issue there. And so the type 1.5 is called glycotoxic. I mean, so like sugar issues. If you have sugar issues, we eat a lot of sweets in our life. If we have sugar in our diet wise, and people have a problem with the insulin, insulin affects our brain growth, and so definitely that's their type 3 is toxic. That could be anything. It could be from mold. It could be from chemicals. But they say that's a tough one because it's really affected by stress quite a lot. I saw somebody who was like had mold issues there and stuff. Type 4 is vascular. That's more like your blood vessels are kind of off. And type 5 is traumatic, and that it's more in terms of like I mean, you talk football players or that kind of stuff there and stuff. And these are not clear-cut types because most people when they have they try to figure out different subtypes, they usually may have multiple subtypes and maybe one type is more predominant than others, but it's usually multiple types there. So it's never like, okay, I just have one type and stuff like that. So.
That's interesting. And so the type of Alzheimer's that you have will determine what type of treatment you get.
Yes.
You treat based on the subtype, so
Yes.
not every Alzheimer's patient gets treated the same on Recode. You figure out what subtypes or more they have, and that's how you treat them.
Right. I mean that's yeah. So this is where the functional medicine part of Recode protocol is like everybody's life is different. Everybody's health issue is different. They may have the diagnosis, but their underlying parts of why they have the diagnosis is different, and so that has to be addressed basically. Yes.
Wow, that's interesting. Any other questions before we go?
I had one more thing. We talked about the Vanthia study there, and so there's 50 people was part of who were on the Recode protocol, and 23 were not. And after the 9-month study, the people who were on the standard protocol, well, I want to get better too, right? So they went on to the Recode protocol, and and they got better within 6 months. So I thought that was kind of a cute thing that they did, where they sort of like had people who were on the standard treatment, and they got a chance to go on the Recode protocol and see improvement there. So that was kind of cool. So
Wow. So all of them improved within 6 months?
I'm not sure how many of them did, but some of them did some of them improved within 6 months or stuff like that. So that was kind of cool. Yeah.
Yeah, that's
Yeah.
really cool.
Yeah.
All right, last call for questions before we go. All right. Well, thank you so much for joining everyone. And thank you, Dr. Richard, for sharing your insights with us and your broad experience in this area. It was really, I learned a lot. I hope everyone else did. And again, I'll be sending out an email after the call with a link if you would like to book time with Dr. Richard and I to, chat further. We'd be happy to chat with you.
Yeah. Thank you for having me on board. It was great.
Yeah. All right. Thanks everyone so much. I hope everyone has a good night. All right. Bye now.